Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Public media is under immediate threat. I'm General Manager Tom Michael from Boise State Public Radio. In the coming days, the U.S. Senate is expected to vote on a rescission request from the White House, which wants to claw back funds that were already approved by Congress. This station is one of hundreds across the country that would lose out. You can let your U.S. Senator know directly that you value funding for public radio. Or visit protectmypublicmedia.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. A coalition of doctors' groups and public health organizations, which include the American Academy of Pediatrics, is suing Health and Human Services Secretary Robert F. Kennedy Jr. The lawsuit claims his approach to vaccine policy is putting public health at risk. Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email at idahomatters@boisestate.edu. All right, Dr. Pate, let's start with this lawsuit. First, what groups are suing? I mentioned the American Academy of Pediatrics, but there are other organizations as well.
Yes, these are a number of prominent organizations. The American Academy of Pediatrics that you mentioned, the American College of Physicians, which is a group typically more aimed at adult physicians and those specialists, the American Public Health Association, the Infectious Diseases Society of America, Massachusetts Public Health Association, and a Society for Maternal Fetal Medicine, as well as an individual physician.
And Dr. Pate, this individual physician, if I read this correctly, her identity is not being given out. However, she is pregnant, and she says she is concerned about her ability to potentially get the COVID vaccine because part of this lawsuit cites RFK's decision to not recommend the COVID vaccine to pregnant women and children. So talk to us a little bit more about this.
Exactly. So the addition of this physician who is pregnant, as you mentioned, is a move to make sure that the court would take the case, because you have to have parties to a lawsuit have to actually face some legal threat or harm to be able to get standing so that the court can hear the case. So I think her addition to all these others helps make that a much easier decision for the judge. What the plaintiffs are alleging is that that really the actions of Secretary Kennedy have bypassed the Federal Administrative Procedures Act, which have a process in place for how the government can make decisions such that it makes sure that agencies don't make what are called in legal terms arbitrary or capricious decisions, meaning that they don't have a good basis in fact, or that there's no abuse of the process where proper input isn't obtained. And in this case, they're alleging both. First of all, they provide very good evidence that even just a week earlier, authorities from HHS published an article in the New England Journal of Medicine making it clear that pregnant women were in the high-risk group. The CDC website indicated, and of course you and I have talked about the fact that pregnant women are at much higher risk for severe outcomes with COVID, and COVID can also hurt that unborn child. And so they show that there's really no basis. Secretary Kennedy didn't articulate a scientific basis for his sudden change in position. And then I think another big part of the case is the fact that he acted, and you and I talked about it at the time, that he came out with this guidance like a week before the advisory committee on immunization
Hmm.
practices was due to meet, and he made this decision by himself apparently, and so that's why they're bringing this lawsuit to get this overturned and the guidance changed.
The lead attorney for the plaintiffs, his name is Richard H. Hughes IV. He spoke to ABC News, and I want to quote what he said, Dr. Pate. He said, quote, "This administration is in an existential threat to vaccination in America, and those in charge are only just getting started. If left unchecked, Secretary Kennedy will accomplish his goal of ridding the United States of vaccines, which would unleash a wave of preventable harm on our nation's children." Unquote. What are your thoughts on that? Because that is some strong language.
It is, and I certainly think that this is a threat. There are many people that historically, because we have been able to look to our top leaders, our top public health agencies, et cetera, for guidance, that when the Secretary of Health makes a public pronouncement, people are going to take that and give it some credibility. And I think what they do a good job in this petition outlining is all the reasons why that credibility is undermined, and that it does not appear, despite what they are saying, that these leaders within the Department of Health and Human Services really are following the science, and that as a consequence, and they mentioned many statements from physicians in different areas of practice giving
Hmm.
testimony that since that guidance came out, they're already having patients questioning whether they should be getting the COVID vaccine. That there are pregnant women pushing back and saying, well, even though the obstetrician is recommending it, well, but the HHS says we shouldn't get it, or the secretary says we shouldn't get it, whatever. Pediatricians saying the same thing is happening. And so what they are doing is making the case that we are already seeing confidence being shaken, and people who in the past did get these vaccines are now questioning it, uncertain, and this creates a really bad place for physicians to be in, because physicians want to follow the science. They want to make sure that their practice is in accordance with standards. And this is a real problem with when one of the highest government agencies comes out with a standard that they're setting that is in conflict with what doctors know to be the best standard.
And on top of that, Dr. Pate, there is a new dominant COVID variant now in here in the United States. It's I guess it's being called Nimbus. It, can you tell us more about this? Because here we are with the Health and Human Services Secretary saying, not recommending it for pregnant women, not recommending it for healthy children. Yet here we are again, right? A new variant.
Yes, and this has been the story throughout the pandemic. We have seen this virus go through mutations initially. Then you'll remember that starting in January of 2022, on your show, we started talking about the fact that not only are we seeing this rapid accumulation of mutations, which can help improve the virus's fitness, meaning its ability to transmit and infect people. Uh, what we started seeing in January of 22 was recombinations, where
Hmm.
the virus is swapping whole parts of the virus with other viruses, and now we are even seeing recombinations of recombinations. And so this has been happening, and now the moves, instead of what we saw earlier, which were primarily directed at increasing the transmissibility and infectiousness of the virus, now are more aimed at evading whatever immunity people have from vaccines and in prior infections. And so this nimbus that you're talking about, or NB 1.8.1, is currently the largest circulating variant. Although I would add the caveat that we are not doing the same amount of sequencing and testing that
Hmm.
we used to do. And this data may be not as reliable from the CDC now, but it is the largest. And according to their data, it is still increasing. There's another variant that is increasing that we have seen gain speed in other countries, and I expect it will here as well. That one's referred to as stratus. The point of all this for the listeners is this virus is continuing to try to find ways to infect people. That's what the virus does. And
Hmm.
if you are relying on the last time that you were known to be infected, maybe a year ago or so, you have to know that immunity, just like if you were vaccinated just a year ago, is going to wane. And that's why this is a great concern, the change in the COVID recommendations from HHS, because children remain at risk. Long COVID in children has now overtaken the disability caused by asthma in children.
Mm.
Acute infections in children, particularly under a year old, particularly in that first 6 months, is the risk of a child 6 months or younger being admitted with COVID to the hospital is about the same as 75-year-olds. And
Oh my
the
gosh.
best way to protect them is to vaccinate the mother. But now Secretary Kennedy is saying, no, we're not recommending vaccines for pregnant women. Well, this is putting the women and their newborn babies at risk because we can't vaccinate them in the first 6 months. But if we vaccinate mom, it'll protect the baby. So these are all concerns. We're going to see resurgences like this because people aren't keeping up. We've got low rates of vaccination, and because they may have been infected some time ago, they may not have immunity today, and we're going to see problems.
And Dr. Pate, I know that as you mentioned, we're not keeping statistics like what was being done during the pandemic. At least when we were at the height of the pandemic. I will say this though, anecdotally, my husband has a colleague who got COVID recently and described that quote razor blade sore throat that this nimbus is being characterized with. So the likelihood is it's here in Idaho.
Oh, and we know it is. We know that it is circulating. It always has been, and it's been changing in forms. And yes, I Nimbus is here in Idaho, and as you're saying, people that have been infected with that, we tend to get more frequently complaints of how bad the sore throat is, and similar to they describe it very graphically and alarmingly as like you're swallowing razor blades.
Oh.
This new variant that's coming out, stratus, that we're seeing rise in the population, we're seeing more complaints of hoarseness with that. But I would caution your listeners, don't depend on these particular trendy symptoms. Like, people remember when we used to see a lot of people lose their taste or lose their smell.
Mhm.
These kind of symptoms don't impact everybody. So just because you don't have a severe sore throat, but you're sick, you got fever, you got respiratory symptoms, that doesn't mean it's not COVID. So you still need to get checked. The antivirals still work, particularly for those high risk groups. But we shouldn't take this casually because we do have mounting evidence that the more infections you get, the more you at risk for long term complications. And we are seeing this in the data already.
So, Dr. Pate, the U.S. has reported 1,288 measles cases this year. This is the highest number in 33 years. Now, this is according to the latest figures from the Centers for Disease Control and Prevention. And the last time that the United States saw more measles cases was in 1992. And this was 8 years before the disease was declared eliminated here in the United States. So, Dr. Pate, we have talked about this numerous times, but as these numbers continue to rise, we are on the verge of basically losing our status here in the United States when it comes to eliminating a disease, to eliminating the measles. What are your thoughts on this, in particular with the fact that we've had this status for upwards of 25 years?
It is truly shocking. If you think back to when I was in practice during this time that we did, eliminate measles, and what a great accomplishment that was. And I would never have imagined that the United States would go back to allowing one of the most infectious diseases that is also vaccine preventable to research. That would have been shocking. Of course, today I'm not shocked because the misinformation and the disinformation is continuing to gain speed. And especially, as we talked about in the first segment, because that information is even being legitimized by local governments with appointments of physicians that are spreading disinformation to public health boards. We've got two state surgeon generals that are, frankly, anti vax in the country. Now we have the leader of the Department of Health and Human Services, who's spent a good part of his career running one of the largest anti-vax organizations. So, of course, today it's not shocking. But if you'd have asked me back there in the '90s, if or 2000, if I thought this day would ever come, I would have said, "Of course not. We've learned our lesson. We're grateful for these safe and effective vaccines." And physicians at that point were hardly ever seeing a measles case.
Well, and Dr. Pate, before we had eradicated measles here, a lot of people got the measles. I mean, children got the measles, and in fact, all you have to do is go look at the science. Upwards of 500 children a year died in the United States every year from the measles before we had the vaccine. The CDC also notes that this year, 1 in 8 measles cases has resulted in hospitalization. So I know you've talked about this before, but this is an incredibly contagious disease, and it's not always mild for people, in particular kids.
Well, that's right. And I think this is one of the anti vax talking points that, well, wait, uh, we were, those of us that are my age and Secretary Kennedy's age, hey, we were kids. Everybody got measles. We're okay. We're alive. Yes, because those who died aren't here to tell you, hey, it killed me, or somebody who got deafness from it or blindness from it as an infant, or a mother who lost the pregnancy because of measles. They're not out there, shouting that and telling people. So people think, it must be a nothing burger. But in fact, just as you said, it's children that die not only with the measles, and we've talked about this before, but it bears repeating. Even if you survive the measles, what can happen, first of all, we already know that in the next few years, those children, commonly anti-vaxxers saying you want to get that natural infection because it strengthens your immunity. That is not
Mhm.
correct with measles. Your immunity is actually weakened. And we learned this because looking at the data, we saw that children that had measles and survived it, but they had increased death rates from other infections in the next few years. What we found out, the measles virus is targeting a specific immune cell, and it wipes out some proportion of your antibody response to other things that you already acquired immunity to. So these children are at greater risk of dying in the next few years. And then we talked about, fortunately, a very rare, but a complication that this child who seemingly recovered from measles in the next 3 to 7 years could all of a sudden develop a rapidly deteriorating neurodegenerative condition where they get disoriented, they may not be able to communicate, and they die in 100% of cases. This is, why do we want to go through that? Why do we want to take the chance, even if it's small? And that's why most parents and most doctors still vaccinate their children.
So, Dr. Pate, how do we get an outbreak like this under control?
So, in the situation where we are while the outbreak is spreading, like it is now, the only way to effectively end it is you have to vaccinate those who are not vaccinated, that are so that are old enough to be vaccinated. You need to vaccinate them because they can be exposed. And even, and we talked about this before, this virus is so contagious that perhaps if the child was in a classroom but left, and you didn't know it, and you came into that room a half hour later, that virus is still there. You could still get infected. So the only effective way to do this is to vaccinate all those who are not already protected, get them vaccinated. But we're having trouble getting people vaccinated. And then the other thing is, for those children too young to be vaccinated, then we have to give them extra protections and to decrease their exposures. And it's tough. And if we can't get the disinformation under control and get people to understand that vaccination is the way to get out of this, this is going to continue to spread. And we are going to see more cases. And unfortunately, it's a matter of statistics. We're going to see more children hospitalized. And even if they survive, that's traumatic. And we're going to see, unfortunately, more deaths.
I want to turn now to an open letter that was signed by more than 300 scientists at the National Institutes of Health. They were criticizing the Trump administration, specifically the administration taking away research funding. Dr. Pate, can you talk to us a little bit more about this? Because what these scientists are saying basically is, you're not allowing us to follow the science. You're not allowing us to continue research because they're claiming it's being politicized, and global collaboration is being interrupted. I, I would think that this has the potential to have large ramifications on research that's happening around things like cancer, Alzheimer's disease.
And it already is. And we're seeing very important research in those areas already disrupted. I've been looking at the advertisements that other countries are making for our scientists.
Mm.
For example, Canada. They are already making the appeal to scientists. Hey, or physicians, if you want to come to Canada, we will streamline the process for you. We will help you get your Canadian citizenship. There's countries in Europe that are telling our leading scientists, we will commit, and even China. I think China just made a commitment to, one scientist, a commitment to fund his research for over a decade. We'll give you the commitment now if you want to come over here and set up. And we already are losing some scientists to this, and and research that's in progress is being stopped. Some of that's going through the courts, some of that's being reinstated. It's very disruptive. And I think that what this letter from all these scientists is pointing out, that although Uh, uh, Secretary Kennedy and some of the others, like NIH director, are saying we're doing gold standard research. That's not true. They are, in fact, politicizing it. They are not doing good research, and in fact, we are wasting dollars because they are saying, well, we want to go back and study these vaccines. These vaccines have already been studied more than most medications and so forth. We know the answers, yet they want to go back and do these studies when there are so many other pressing health needs that we need to find answers for the population. So, yeah, this is it's a very bad situation right now.
We have quite a few listener questions to get to. So, Dr. Pate, Lisa wrote in and she says, I don't know if I got the measles vaccine as a child. So, I recently got the MMR vaccine. My question is, do I need a second vaccine? And if so, when should I get it?
So, Lisa, the answer in general is no, you don't need a second one. However, I do want to encourage you to talk to your physician because there are some circumstances where we might give you a second. For example, I'm assuming you might be more middle aged, but if you are a high school or college student, we might. In fact, want to give you a second dose. If your business takes you on frequent international travel, we might consider a second dose. If you are a hospital worker or you work in around children a lot, daycare, school, then we might consider a second. So that's why I'm saying talk to your physician because I don't know your specific circumstances, but the general answer is you should be fine with one unless you have one of these other particular circumstances.
So, Dr. Pate, what should adults know about the measles vaccine? Because I'm sitting here assuming that I was vaccinated because I know my parents got me vaccinated. My parents aren't alive anymore. I don't know how to ask them, but I have made the assumption due to when the vaccine was first out and my age that I am vaccinated. Is there a way to find out if you are or are not before you go down the path of getting the MMR vaccine as an adult?
Well, you can measure antibody levels, a blood test. But on the other hand, if you want to spare the expense of checking that and getting those
Hmm.
results and the time it would take to get them, uh, it's not. It's such a safe vaccine that if there's a real question about whether you got it, you can just get a dose of the MMR like Lisa did. The qualifications would be because it is it's not a killed vaccine. If you were pregnant, we wouldn't give it to you while you're pregnant, or if you're undergoing cancer chemotherapy or something like that, we might not give it to you right now. But if there's a significant question in your mind, then it's safe to just go ahead and get another dose. That's not going to harm you. But most people that are in my age group either had measles or vaccinated and probably don't need to worry about it.
Okay. Julia writes in and she says, with the new incredibly frustrating announcement from the FDA about COVID vaccine eligibility, will people under 65 or without underlying health conditions need to visit another country to access the vaccine? Will a doctor's recommendation be sufficient to override this new policy and allow access to anyone who wants the vaccine here in the US?
Well, it's a great question. I don't think you're going to need to go to another country, but here's the issue. If you are in the group that you just mentioned that doesn't have the recommendation for the vaccine, although if I was in that category, I would still get vaccinated. What it means is that you're probably not going to be able to walk into one of the pharmacies and get the vaccine. The pharmacies are generally following these guidelines pretty strictly. So the way that you should handle it is, or the way I would handle it if I was in that situation, I'd ask my doctor if I could have the vaccine. Your doctor is likely to say yes. And if your doctor has the COVID vaccine, then you can get it there. Now, your doctor may say, yes, a good idea, or yes, you should get it. But they may not have the COVID vaccine, and they may want you to go to a pharmacy or something. If that's the case, you'll need more than a recommendation to ensure that you won't have a hang up at the pharmacy. I would just ask the physician, can you write me a prescription for the vaccination, or write a note saying that, gee, my patient David Pate, he does need this, because otherwise you may get denied at the pharmacy. The other issue is that because you're not in that covered age group, you may have to pay for the vaccine. So
Mhm.
that's the other issue.
Could we do the same thing for our kids, Dr. Pate, like go to their pediatrician and do what you just recommended as well if we want our kids to get the
A-
vaccine?
Absolutely. And that's exactly what I would do. Your pediatrician, your family physician, because they do know that it is not good for our children to get repeatedly infected, and that in fact, we're less able to predict which children are going to get seriously ill with COVID. So, yes, go to your pediatrician or family physician.
Anne writes in, she says, Robert Kennedy Jr. wants access to children's medical records to learn who has autism. I am a registered nurse, and there are very tight controls with the HIPAA laws about health information. She says, Dr. Pate, why would Mr. Kennedy be allowed to access this private medical information?
Well, I don't think he will. I mean, I do get surprised every day, so I am not confident in my answer. But I don't think that's going to happen. And frankly, I think that was all part of the hysteria he was working up about autism and vaccines and all. Um, so I don't think that's the area to worry about today. Plus, he has already said that he's coming out with a study in 2 months that's going to show us the answer to autism. And surprise, surprise, I'm sure he's going to have something that suggests it's vaccines, even though all of the research done to date that is of inequality has shown there is no association. I wouldn't lose sleep over this one. I think there's a lot of other things for us to lose sleep about. I don't think this is going to happen.
Susan, who is a doctor, apparently she heard us talking, Dr. Pate, about when to give the MMR vaccine. So she wrote in and she said that a lot of pediatricians are starting to give the first MMR vaccine at 1 year of age now in order to get the vaccine on board as soon as possible. So, Dr. Pate, that because the recommendation is still, I think, 15 months, right? But maybe because we're seeing this outbreak, pediatricians are starting to give it at a year old. But I would think you would still have to have a conversation with your pediatrician.
Yeah, the listener is correct. I think a lot of physicians have moved to the 12 months. Actually, the recommendation is 12 months to 15 months. So it's been
Okay.
a range. I think a lot of times it's just been the timing that it has been convenient for having kids come in and get the vaccine at 15 months, like you said. But it's always been approved for 12 to 15. And I think because of the fact that now there is much more risk of exposure. Instead of going with kind of the 15-month end of the scale, now they're doing 12. And in fact, if there is a infant less than 12 that is going to be in some particular high risk situation, we can consider, but that does need to be in a discussion with the pediatrician or infectious disease doctor, even vaccinating earlier than that. The reason we don't is because the this vaccine gives essentially lifetime protection. But if you get it before the 1 year mark, it is less reliable at giving you that long
Mm.
term protection. So if we decide there's such high risk that we want to do it early, then we may still have that child go through the 2-shot series a little bit later. But that's how we're handling it right now.
Yeah, I mean, bottom line, talk to your pediatrician, I would think, Dr. Pate, because I'm thinking about as we are, counting down to school starting. And, my concern is all the kids head back to school and boom, the measles shows up in Idaho if it isn't here already, right? And we already have low
Exactly.
vaccination, and we have low vaccination rates historically here in Idaho.
Yes.
So I'm thinking about people who are sending their kiddos to preschool to kindergarten who might have younger kids at home. Might be a good idea to have that conversation with your pediatrician.
Absolutely, because I will be absolutely shocked if it doesn't come to Idaho. I'm certain it's coming here.
Well, as always, Dr. Pate, we so appreciate you and appreciate all of your time you take with us. We've been speaking with Dr. David Pate. He is the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. And remember, if you have any questions about public health, send us an email, idahomatters@boisestate.edu. We will send them to Dr. Pate, and he will answer them on the show for us. This is the Idaho Matters podcast. I'm Gemma Gaudet.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.